Stroke is the fourth leading cause of death in Wales. Stroke can change lives in an instant, but with the right specialist support, people can make a good recovery and go on to rebuild their life. During a stroke, the brain's blood supply is cut off. Brain cells, deprived of oxygen, begin to die within minutes. There are effective treatments, but these need to be delivered quickly. That means identifying stroke patients quickly and confirming the right treatment is vital to a patient's outcome.
I'm Dr. Shakil Ahmed. I'm the National Clinical Lead for Stroke in Wales, and I'm a consultant in Cardiff and Vale University Hospital. Every minute when a patient is having a stroke, when the arteries are blocked, you are losing up to 2 million brain cells a minute.
Identifying stroke using the traditional fast approach is helpful, but only 50% accurate. Specialist diagnosis is better and is around 90% accurate. Therefore, we need to bring the stroke specialist to the patient and ambulance crews to help support the diagnosis and determine their immediate care plan. NHS Performance and Improvement has been running 5 pilots in health boards across Wales. Using a system called Pre-Hospital Video Triage (PHVT) is a real-time video consultation between ambulance clinicians, patients and clinical stroke specialists. It enables stroke specialists to visually assess symptoms, guide the ambulance clinicians and make early decisions about the best care pathway. It expedites and improves decision-making when a timely differential diagnosis is critical.
There are treatments now where we can unblock the artery, where we can give the drug to unblock the artery, or we can do a procedure to take the clot out as well. But this treatment is very time dependent. Now there's been some real great work going on in Wales with regards to making that pathway as smooth as possible and to see if we can make it really, really effective. But in order to speed up the process as well, we've been doing some various pilots as well, working with our colleagues in Welsh Ambulance Services. We ran a pilot, what we call the pre-hospital video triage, is where when the ambulance services go and they go to a patient, rather than just bringing them straight to the hospital, what we do is we connect the stroke consultant or the stroke team with the ambulance services. So we have a joint assessment together with our colleagues with the Welsh Ambulance Services and the team in the hospital. And then we ask a few more questions, we do an examination together, and then at that time we make a decision about, is this patient likely to have a stroke? So it's really important that we select the right group of patients to come into the hospital as well. So our pilot has been very successful and it had some really, really good outcomes as well. We can then try and fast track that patient into the hospital, into the scanner, and to make sure that they get the treatment earlier as well. By doing the pre-hospital video triage, we can select the right patient and making sure that they get to the treatment quickly. And the other advantage with using the pre-hospital video triage is that some of the patients that don't necessarily need to come in, we can make some decisions with the consultant as well about maybe treating them at home or putting them on the right care pathway as well. And we've had some great examples as well where we've avoided hospital admissions as well.
My name is Mike Jenkins. I'm the Consultant Paramedic Regional Clinical Lead for South East Wales. I'm also the Welsh Ambulance Services University NHS Trust Stroke Lead. We've been working with Cardiff and the Vale University Health Board for over 2 years now, along with Dr. Shakil Ahmed, the National Stroke Lead. We've been developing pre-hospital video triage for our staff to be able to use when presented with patients with a medical cause for a neurological condition where stroke cannot be ruled out. The benefit this has is it allows our staff who are presented with a patient who may be suffering a stroke to have access to a senior stroke consultant who can then support their decision making on where that patient needs to be conveyed to. The benefits for the Welsh Ambulance Service and for other patients who are presenting with a stroke mimic, there exists the potential for those patients to remain closer to home. So that could involve the patient being admitted to a hospital closer to home, not having to travel further to the dedicated stroke unit, or in some circumstances those patients actually being managed in the community with a referral on to their local GP or into a clinic within a hospital setting within a 24-hour period. That has huge benefits for the patient, but also for the Welsh Ambulance Service, enabling us to keep our ambulances closer to their geographical footprint within any given health board area, increasing their ability to respond to other life-threatening calls in a timely fashion. Next steps in relation to pre-hospital video triage is to evaluate the work that we've done with health boards across Wales in relation to pre-hospital video triage, but then to evaluate the success of the programme. Moving forward, there are other conditions where we perceive that there's potential benefit. Conditions such as mental health, end-of-life care, obstetrics, where WAST paramedics, EMTs have minimal exposure to. The ability to access specialists within those given areas to support our staff, again, is going to be invaluable for us as an ambulance service, the patient who will be on the receiving end of that advice, and ultimately the care that those patients are going to be provided.